Imagine you need a quick, authoritative overview of a complex field. Maybe you're prepping for a big meeting, or you're just really curious about something that feels a bit, opaque from the outside. Well, today, we're giving you exactly that kind of shortcut for a truly fascinating and increasingly vital area of study: health economics.
Yeah, it's a big one.
It really is.
Yeah.
It's so much more than just, healthcare costs. It's the meticulous application of deep economic principles to health, to illness.
Right.
And it's seen absolutely explosive growth in recent decades.
That's right. And our mission today is to take a bibliometric deep dive.
Okay, bibliometric.
Yeah.
What exactly does that mean for us?
Well, it means we're not just looking at the subject of health economics itself. We're actually looking at the data about the research.
Okay.
So we're examining who's publishing in this field, what specific topics they're focusing on, and, where this research is taking place around the globe. And we're using a really insightful paper from the World Bank that analyzed 4 decades of research in health economics. Think of it as a map of the knowledge landscape, really charting the rise of this key discipline.
Okay, so let's unpack this then. It's kind of surprising, isn't it? I mean, you think about other economic subfields like agricultural economics or international economics.
Yeah, they go way back.
Exactly, way back to the early 1900s in books. So what do you think the biggest hurdle was for health economics initially? It didn't really pop up in book titles until the 1940s. Seems like a late bloomer.
It absolutely was. And for those first couple of decades, the growth was, well, surprisingly slow. But then something shifted dramatically. Around the mid-1960s, there was this sharp, undeniable increase in activity.
A real turning point.
Definitely. And that momentum has largely continued ever since. It really propelled the field forward.
And it truly exploded. When you look at the actual numbers, the growth is staggering.
It is.
By 2010, health economics had piled up over 33,000 publications. Now, to give you some perspective.
That's a remarkable 12,000 more publications than the economics of education.
Wow.
Which was a field that actually ran neck and neck with health economics until the early 1980s.
Right.
Then health economics just pulled away.
Right.
And why does this explosive growth matter to you? Well, it means that decisions about healthcare policy, insurance design, public health stuff, they're increasingly informed by rigorous economic analysis.
Moving beyond just gut feelings.
Exactly. Moving to data-driven solutions that, directly impact everyone.
And this rapid expansion wasn't just random. It was, as Splagg noted back in '98, driven by some key factors.
Okay.
A really crucial paper by Kenneth Arrow in 1963 on medical insurance played a huge role.
The Arrow paper, right? Seminal.
Absolutely. It didn't just make the field respectable among economists, but maybe more importantly, it made it interesting. And that sparked this wave of curiosity in the unique ways nonprofit health institutions work, how healthcare gets financed, how you actually measure healthcare outputs effectively.
Complex stuff. Really complex. And that delicate balance between efficiency and equity, plus the rise of health technology assessment. These were all areas just ripe for economic analysis, drawing in a whole new generation of researchers.
So given it's such a broad and evolving field, how did the researchers for this World Bank paper actually, define health economics for their study? Must have been tricky.
They took a very pragmatic approach, actually. They mostly relied on EconLit's classification system.
Okay, the standard economics database.
Right. Looking for publications with substantial economics content and specific JEL codes, that's the Journal of Economic Literature codes, related to health.
Makes sense.
But then to get a fuller picture, make sure they weren't missing key stuff, they supplemented that official classification with citation data from Google Scholar.
Ah, okay. So kind of blending the official list with real-world impact.
Exactly. It was a smart mix of structured taxonomy and impact measurement.
That brings us nicely to measuring influence then, because it's one thing to just count papers, right? But how do you quantify actual impact?
Precisely. Bibliometrics isn't just about the sheer volume. The core assumption, and it's a pretty powerful one, is that a paper that gets cited a lot, well, it's probably more influential than one that doesn't.
Right. You're trying to capture that lasting effect.
Exactly. The impact a piece of research has on the wider academic community and, by extension, on policy and general understanding.
And here's where it gets really interesting, because measuring that scholarly influence isn't as simple as it sounds. We hear about different metrics, and this paper used a few key ones to get a sort of rounded view.
Right.
So Beyond just the basic publication count, sheer volume or total citations, just how many times someone's referenced. They used more sophisticated measures.
Like the H index.
Yeah, exactly, the H index. That's a popular one. It tries to balance an author's productivity with the impact of their work. So an H index of 20 means an author has 20 papers, and each of those has been cited at least 20 times.
Okay, got it.
But they also use things like the I3 index, which gives a bit more weight to those really highly cited publications.
Trying to reward the blockbuster, so to speak.
Kinda, yeah. The key takeaway is they weren't just counting. They were really trying to capture the impact, the resonance of the research. And these different tools help them do that, even though they ran into some serious data challenges.
Oh, and those data challenges were significant. Even with sophisticated tools, you get issues like inconsistent titles across different databases,
Yeah.
ambiguous entries in Google Scholar, and just the sheer amount of manual cleaning needed for author names.
Like typos and variations.
Exactly. They mentioned one example, Matthias von der Schulenburg, whose name apparently showed up in 10 different ways.
Wow, 10. That's a lot of cleaning.
It really is. And of course, institutional affiliations needed tons of manual cleaning too, just to group the records correctly.
Yeah.
It really shows the painstaking effort behind a study like this.
That detailed work definitely underpins the whole thing. But now with that solid foundation, we can finally dive into what the data actually reveals. What are health economists spending their time researching?
Well, what's fascinating is seeing how the focus has shifted over time. The single biggest category for the most cited topics is determinants of health and ill health.
Okay, so what causes good or bad health?
Pretty much. This includes really foundational work like Becker and his colleagues on cigarette addiction.
Classic.
Definitely. Disgupta's profound work in inquiry into well-being and destitution, and James Smith's insights on that crucial link between health and wealth.
A health-wealth nexus, right.
Exactly. Other really big areas include economic evaluation. Think classics like Torrance on measuring health states, or Weinstein on cost-effectiveness analysis. And public health may be best exemplified by Culyer, Glaser, and Shapiro's really influential work on obesity in America.
It's clear the field isn't static, though. You mentioned shifts. Over these 4 decades, topics like medical insurance and supply of health services, they've actually seen a clear downward trend in the most cited list. Does that mean those problems are solved? Or just less focus?
I think it's more a shift in emphasis, because in contrast, determinants of health and ill health, like we just mentioned, and also health statistics and econometrics, they show a clear upward trend.
So more focus on causes and methods.
Exactly. It really highlights this broadening of interest. The field seems to be moving beyond its initial core institutional questions, like how do hospitals work? How is insurance structured? Towards more behavioral questions, and using sophisticated statistical tools to understand health itself.
So less about the systems, more about the underlying health outcomes and how to measure them.
I think that captures it well. It's understanding the root causes.
It's one thing to see these trends in numbers, but the paper apparently used word clouds from article titles. That sounds like a cool way to visualize it.
It really is. And they beautifully illustrate the shift. You see the commonest words and titles moving away from things like hospitals and insurance.
Traditional stuff.
Right. Towards a much more diverse set of topics, specific applications, technical methods. And you also start to see this growing interest in low-income countries becoming really evident in those clouds, too.
Which leads us nicely to the geographic expansion. Historically, the U.S. has dominated health economics research, right?
Oh, absolutely. But the study reveals a significant broadening of focus, especially into the developing world. Between 1990 and 2009, there was really noticeable growth in research, looking at Africa, Asia, particularly China, and Southeast Asia, Europe, and South America.
That's crucial, isn't it? Because the health challenges in the economic contexts are so different everywhere.
Vitally important. Localized research is key.
But despite this welcome broadening, there are still some big gaps, geographically speaking. Central Asia, parts of Africa, the Middle East, still relatively under-researched by health economists.
Yeah, that's clear from the data.
So what does that actually mean for a region, say Central Asia, to be under-researched in this way? What policy insights might be missing if they're not producing their own localized studies?
Well, that's a really powerful point. Without local health economic research, policy decisions in those regions might end up relying on models or insights from completely different places.
Which might not fit at all.
Exactly. They might not be appropriate or effective. It really underscores this critical need for investment in local research capacity, fostering homegrown expertise to tackle region-specific health challenges properly.
The landscape is global, but the solutions often need to be intensely local.
Couldn't agree more.
Now let's shift gears a bit and talk about the power players. Who are the top minds actually shaping this field? The study identified the top 100 health economists, and it's quite telling. Predominantly American, 71%, and overwhelmingly male at 85%.
That gender imbalance is stark, and when you look at the specific names, some really stand out across multiple metrics, showing consistent influence.
Like who?
Well, David Cutler ranks highest on that EAT index we talked about.
Yeah.
Mark Pauly leads in just the sheer number of publications. And Michael Grossman tops the list for total citations.
Okay, different strengths.
Different strengths, but you also consistently see names like Jonathan Gruber, Joseph Newhouse, W. Kip Viscusi appearing high up, pretty much no matter how you measure it. These are the scholars whose work is really foundational.
And if we zoom out from individuals to institutions,
Harvard University really stands out. It's the clear leader across all the influence measures, H-index, publication volume, total citations, just dominant.
any other major players?
Oh, yes. Other top institutions making huge contributions include the World Bank, UC Berkeley, and the University of Chicago. Consistent powerhouses.
Is there specialization among these top institutions, or do they all cover everything?
That's another fascinating finding. Harvard, despite its dominance, is actually the least specialized. Its researchers cover a really wide array of topics.
Interesting.
But in contrast, you see places like MIT showing strong concentrations, maybe heavily focused on medical insurance, or the University of York in the UK, which leans heavily into economic evaluation.
So they carve out niches.
Exactly. Each institution seems to cultivate its unique strengths within the broader field.
And finally, let's touch on where this research gets published, the influential platforms. I assume the specialized journals are key.
They are. The Journal of Health Economics and Health Economics are, as you'd expect, the leading dedicated journals.
Makes sense.
But it's really worth noting that the top general economics journals like Econometrica or the Quarterly Journal of Economics show remarkably high citation rates per health economics article they publish.
Oh, really? So when they publish Health Econ, it's usually a big deal.
It suggests that. It implies that the health economics research appearing in these broader, top-tier journals tends to be particularly impactful, resonating across the entire economics discipline, not just the subfield.
Pushing the boundaries of economic thought itself.
Potentially, yes. And there's one other publication type to mention: edited volumes.
Right.
One completely dominates: the Handbook of Health Economics. It just shows exceptionally high quality and influence. Its normalized H-index, which adjusts for the number of publications, is actually better than any single journal.
Wow. That's a serious testament to its impact as a go-to reference.
Absolutely, a cornerstone resource.
So taking all this in, what does it all mean for us, as we try to navigate the complex world of health? This deep dive really shows the incredible journey of health economics.
It really does.
How it went from this relatively niche interest back in the 40s into this vibrant, highly specialized, and globally influential academic field today. It's a powerful example of how a discipline can expand its boundaries and deepen its insights into such a critical area of human life.
And if we connect this back to that bigger picture, Arrow's 1963 paper, it didn't just make health economics respectable, it made it interesting.
Right, that distinction.
Because he was applying standard economic models to these unique, sometimes really uncomfortable features of medical markets.
Like what?
Well, grappling with concepts like trust between a patient and a doctor, moral hazard in insurance, information asymmetry, knowing more than the other party. These were pretty novel things for economists to tackle head-on back then.
And they're not just dry economic concepts, are they?
Not at all. They cut right to the core of how we organize and pay for healthcare. They inherently touch on really deep ethical considerations.
Which raises a pretty important question, I think. Has health economics truly fulfilled that foundational promise that Arrow kind of laid out?
That's a big question.
I mean, it's certainly gained immense respect, loads of funding. But has it fully grappled with the really tough ethical dilemmas, things inherent in healthcare investment, insurance design, especially when you get into valuing life or allocating scarce resources?
That is a profound challenge, and I'd say the field is continually evolving to meet it. Economists are increasingly incorporating insights from behavioral economics, from experimental work, even from psychology.
which sometimes push back against the old assumptions.
Exactly. They sometimes challenge those traditional foundations of purely rational economic behavior. And this push towards a more nuanced understanding is absolutely critical, I think, for health economics to truly address the messy complexities of human health and well-being.
Absolutely, because this field, ultimately, it's not just about numbers or efficiency graphs. It's about deeply human challenges.
Right.
And those challenges continue to push economic thought itself in really fascinating new directions. It's about figuring out how we build systems that aren't just efficient, but also, equitable and compassionate when facing profound human needs.